Thank you, Mr. Speaker. When a young person is dealing with a mental illness, family can be one of the most important lifelines. However, families aren't always equipped to deal with the additional strain of caring for someone with mental illness. In order for them to be effective and to support their loved ones, families need our support. They need to know what the resources are and where they're available and how to access those resources. To the Minister of Health, Minister, I've heard from constituents that are caring for a child with mental illness and they don't know where to turn. What is your government doing to connect families with the help that they need?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the important question. I want to assure all Albertans, if you're ever at a time of crisis, if it's an emergency, please call 911. And if it's something that you want, that you have a little more time to process and you want some advice on, you can always call 811 and speak to a licensed registered nurse here in the province of Alberta, and they will help navigate through some of the options that are available. But in terms of system investments, we've increased capacity for children and families by building the Rutherford Mental Health Clinic here in Edmonton. We've also funded new counselling supports for survivors of sexual and physical assault through the Zebra Child Protection Centre, and they supported over 1,600 children and youth last year, Mr. Speaker.
Well, we all hope that someone dealing with a mental illness can rely on the support of friends and family. That simply isn't always the case, whether it's because they have no one to turn to or because the people in their life aren't equipped to help them. Many people suffering from mental illness are at risk of isolation, homelessness, and much more. This is especially a concern for someone who's being discharged from a facility, and as that transition, it often results in falling through the cracks for these patients. To the same minister, what specifically is your government doing to ensure support for those suffering from mental illness after they've been discharged from a facility?
The Honourable Minister.
Thank you very much, Mr. Speaker, and again for the question. Currently, we are on the process of monitoring over 150 initiatives that our government has been led and involved with because of the valuing mental health work that we did when we were first elected. And I want to thank the former Associate Minister of Health for her work on that important file as well. There are 18 actions specifically related to valuing mental health next steps, including the building of an 8-bed youth facility in Red Deer, increasing psychiatric emergency service outreach at the Alberta Children's Hospital, Mr. Speaker, and the list goes on. We need to continue doing more, but much has been done.
Supplemental.
The issues that I've talked about today are symptoms of a much larger mental health crisis in our province. While spending has gone up, we're still struggling to improve outcomes. What we need is a province-wide vision for how we approach mental illness and to help those who are suffering. The Valuing Mental Health report is a first good step, but we need to make sure that the recommendations are being adapted into a holistic approach to mental illness, not simply being applied in a piecemeal fashion. To the same minister, how close are we to full implementation of that report, and is your ministry pushing for a more holistic mental health strategy for all of Alberta?
The Honourable Minister.
Thank you, Mr. Speaker, and that's exactly what we're doing. That's why we didn't stop when we wrote a report. Many people said to us when we embarked on this process, we've written reports before and they sit on a shelf. It was really important to them that this new government, that our NDP government under the leader of our Premier, develop next steps, and that's why we have the 18 steps identified under the Valuing Mental Health Next Steps report, Mr. Speaker. We've also increased investment through the mental health capacity building in schools. Now over 65,000 students in 182 schools in 85 communities have additional supports because this side of the House voted to increase the budget and give those supports to families, while members on that side of the House voted to slash them and lay off frontline workers, Mr. Speaker. I think we know who's got the backs of the Honourable Minister.